Well, what comes to your mind when you hear Cameroon? I was really surprised and shocked that some of the people did not know what Cameroon was. And it's not their fault. And well, that brings me to tell you about my country a little bit. Cameroon is a great place. It's an amazing place full of people with lots of abilities, lots of capacities, lots of dreamers. But sincerely, there are so many things which are not on point yet.
Sierra Leone, my country, we have come a long way. We used to be the anthems of West Africa. The old Fairway College used to be the single most influential university in the sub-Sahara and even in Africa as a whole. But fast forward to after independence, we had a lot of problems as a country, some of which was the 11 years civil war. So we see a lot of vibrant young youth, educated youth, fleeing as refugees to different African countries. And also there was a lot of destruction in properties and lives. And the livelihood of our country was in turmoil.
The word of a nation is its people, and health is wealth. Nigeria gained her independence on the 1st of October 1960, and ever since then we have seen like certain improvements. We've seen like the government investing in building hospitals and building healthcare centers, in training medical professionals. But even with this, the Nigerian healthcare system actually did face like certain challenges, like inadequate funding or even lack of skilled professionals, and with a major element of corruption. So we saw Nigeria like bringing in certain initiatives, but then there was lack of accountability, lack of transparency, and one of them was the basic health care scheme.
Zambia got its independence in 1964 from Britain, and since then there has been significant changes in the education system, both infrastructure-wise and quality-wise. Back then, Zambia's education was hugely centered to meet the demands of our colonial masters, the British. So most of the people that were trained at that time were trained to be clerks, farm engineers, and all other activities that benefited our colonial masters.
And recovering from that has been difficult, and because it has created a space in which destabilize our human capital development. Just like any other nation, any other country, we are working our best to reach up the ladder. We are one of the most peaceful countries in the world, recognized globally. We are part of the United Nations Security Council, elected this year to serve for 2 years. In leadership, our leadership in the highest level, that's in the ministerial level and the cabinet, we have a lot of young youth. Minister of Education also is a lady, which has been one of the agenda the government is taking to incorporate ladies, women into leadership.
Infrastructure-wise, well, it's not been good at all. I remember 5 years ago, there were lots of roads that had problems and issues, and people cried out that they want it fixed. There were lots of people having problems with unemployment, and everyone called out to the government and hoping that someday things were gonna change. But 5 years down the line, and I got to realize that not a lot had changed. Well, it's a pity, but some things even got worse. Right along where I live, there were some roads which were better before, and now they are worse. There were people who had hope of employment after their high school, medical students who were directly integrated into the government after high school, and now there is no more of such integrations because the spaces are limited.
So generally in Nigeria, healthcare is financed from tax revenues, from social health insurance scheme, from private health insurance scheme, from donor fundings, or even out-of-pocket payments. And that's actually when individuals have to pay themselves. And after a while, the International Monetary Fund, the IMF, it proposed that government should let its citizens actually pay out of their pockets. And this was due to microeconomics. But this actually didn't prove or turn out very well for Nigeria, because this meant that people from lower income households in Nigeria couldn't afford quality healthcare services. So in 2000, Nigeria had to scrape that off, though not completely. Nigeria had to adjust this policy by scraping it off partially and making treatment of certain diseases for pregnant women and for children under 5 years old free. These hospitals could not run certain costs, and then our patients had to buy certain things for themselves, like they had to buy things like gloves or syringes, and these were things that could have been covered by the National Health Insurance Scheme.
So at the moment, we have made positive strides, but there's also the negative aspects to it. Let me begin by mentioning a few positive strides that have been made. Previously, there weren't a lot of infrastructure development where education is concerned. But right now, we have seen an increase in the number of educational structures. And apart from that, we have seen more schools they've upgraded from being primary schools to combined schools. We have seen the introduction of practical subjects such as computer studies. This will not only equip us to know the fundamental theory of it, but to also know the practical aspect of everything we're learning. It doesn't end there. The other positive strides that have been made is joining the rest of the world in empowering a girl child. You find that in Zambian schools, girl child are being empowered by lowering the cutoff point as compared to that of a boy child.
Sometimes it's a bit difficult to do a comparative analysis on the Nigerian healthcare system before and now. Like for example, the Nigerian healthcare insurance scheme that was initiated is still unable to cover for a majority of the population of Nigeria. It's still unable to cover for people who do not work professionally, and this will actually make up a bulk of the country's population. Now currently, we're actually experiencing brain drain because we have most specialists and most medical doctors who they've been trained in Nigeria, they studied there for 6 years, they've done their internships and everything. We see them actually immigrating to other countries, and sometimes you actually can't really blame them because the Nigerian healthcare system, the working conditions are not actually very favorable for these professionals to actually thrive, and because of that, they actually get frustrated. Sometimes their salaries are also even withheld, and if this actually keeps on going, I find it difficult to actually imagine how Nigeria's healthcare system is actually going to reach its sustainable goals or development.
One thing I've realized is the difficulty in terms of financial transactions. Well, it's pretty interesting that I didn't know it was a problem till I got to live elsewhere. I got to live in a country where you could send money from one person to another without paying a dime. And then comparing it to my country, you have to pay something to send money, no matter how small it is. Well, it's a business. I'm not saying it's bad, but that's a challenge we have. You can't move money without paying for it. Imagine you're wanting to move maybe $2,000. My currency is France CFA. You've got to pay a percentage of that sum just to transfer that money from one person to another. But it's not the same elsewhere.
In other countries, the teacher-to-pupil ratio stands at an average of 1 to 2. In Zambia, the teacher-to-pupil ratio is 1 to 49. So it's really hard for teachers to monitor the progress of each and every student.
What could my country look like in 5 years? I can only do assumption based on the intentional steps the government and people in high authority places are taking. If our mineral resources are utilized in the appropriate manner, if we have a favorable exporting terms with different partners, we can create jobs opportunity for Sierra Leoneans. We can foster intercontinental corporations. We can have food security. We can have employment for a lot of youth and a lot of hardworking Sierra Leoneans. But it all depends on the steps we take. Our healthcare will improve if we can utilize our resources. But it has to start with all of us, abroad and in our country, from person to person, discussing these terms and creating relevant solutions. This is what FMYDE is all about, to train you, young leaders, Africans, into Pan-Africanism.
So I believe that that's a predominant problem which can be fixed. We can work on our finance systems. We can bring up systems of money transfer, and which will be able to be done without being so expensive and without costing so much.
I'd like our education to be more practical based than theory based. And one thing, like I earlier mentioned, that I'd like to see is the reduction of our teacher to pupil ratio. I believe for a student to fully develop, there needs to be understood by a teacher, and the only way a teacher can understand the mammoth or students and the number of students they are teaching is if the students are few.
Okay, making predictions about what our healthcare system would look like, I think it's okay, it's not very definite, because I would say it involves a lot of variables. I hope to see, like in Nigeria, where the medical records of patients could be assessed by any doctor, by any medical professional. Like, for example, I'm a recent doctor in Russia, and I can actually assess medical records of a patient even from like 5 years back. And I think it actually helps with building treatment plans for these patients, because you already know their history, and knowing their history, you already know what to do and what not to do. And also, when it actually comes to the brain drain that Nigeria is actually currently experiencing right now, with medical professionals immigrating to other countries, it would be very wise if the Nigerian government can really pay attention to making the working conditions of Nigerian medical doctors and healthcare professionals favorable for them.
I would like to see the free education continue in primary and secondary. Additionally, I would like the government to allocate more of their funds to empowering and sponsoring more students across Zambian universities, not only the selected few that we have. Also, the curriculum of Zambia should be reformed. If we are to develop as a country, I believe we need to push our agenda, we need to promote our country. And that is in history, we need to promote our country. In science, we need to promote our country. In art, we need to promote our country in every aspect of development.
We need to create awareness in our youth. The youth have to become more aware of what the situation is actually and what they can do right now to make it better. Some of those things will be to get more knowledge about different fields, to become more professional in diverse spheres of IT, of business, to build up the capacity that is needed to create a change.